Welcome to the recorded version of Aging Brain, Part 1, Brain Basics, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care.
Lakeland Hogan is a gerontologist and caregiver advocate for Home Instead Senior Care. Lakeland works to educate professionals, families, and communities on issues older adults face. Lakeland is a doctoral candidate at the University of Nebraska, Omaha, where she is studying social gerontology. She has a Master's in Arts in Social Gerontology and Master's in Business Administration from UNO. Lakeland has professional experience in the private and public sectors of senior care services. She's worked on special projects for UNO's Department of Gerontology and the local area Agency on Aging. Lakeland serves as the Vice President of the Board of Directors for the Dreamweaver Foundation and is active in the Alzheimer's Association Walk to End Alzheimer's. Lakeland has a passion for helping others, especially aging adults and their families. Lakeland?
Hello, everyone. Thank you so much for that introduction. I'm so glad that you're joining me. As you just heard, this is the first in a two-part series about the understanding the aging brain. Many family caregivers do not realize that as we age, our brain experiences some changes. However, for some older adults, they will experience changes in the brain that are not normal. And it's important for family caregivers and for us as professionals to understand normal versus abnormal aging in the brain so that when an older adult is exhibiting signs and symptoms of abnormal brain aging, that we can make sure they are directed in a timely manner to a medical professional for further evaluation. We know that the brain is a complex organ, and like the rest of our bodily organs, it does age over time. To understand how aging impacts the brain, it's really important to look at brain aging in a variety of categories. We can look at the physiological impacts, our changes in cognition, and also changes in the social psychology. So when working with older adults and their families, it's important to understand these basics of brain aging, and it can be especially helpful to be able to distinguish between normal brain aging versus abnormal, and I'm going to go through that throughout today's presentation. So again, I'm really glad that you're joining me to learn more about this important topic and how to communicate these changes in the brain to the families and the older adults that you work with. So I'm going to get started by just overviewing our objectives for today's webinar. So this month I'm going to give a somewhat high-level overview of brain aging. Then next month I will dive deeper into the various brain aging diseases. So I really hope that you'll tune in for next month's webinar. You should get a link in the follow-up email for you to register for next month because I will go into more depth on those aging brain diseases. But really today I'm going to start out by describing how aging affects the anatomy of the brain. I'm also going to identify normal versus abnormal changes in our cognition as a person ages, and then describe how age can impact our emotions and social behavior. Then talk about resources to help families when they suspect that their loved one is experiencing abnormal brain aging. And I'm also going to talk about healthy brain aging in general and how a person can reduce the risk of aging brain diseases. And this is really good information for people of all ages to know, for us as professionals, for the family caregivers that we work with, and many older adults can also still benefit from healthy brain risk-reducing activities. And so I'm going to wrap up the presentation by talking about that. It's never too early to be taking good care of our brain. So first I'm going to start the presentation by talking about our understanding of the brain and how it has changed. So I recently listened to a lecture given by Dr. Carol Barnes. She's a Regents Professor at the University of Arizona. She did a great job of summarizing the changes in our understanding of the brain from a research community over really the past 50 years. So if we look back about 50 years or so ago, our understanding is shown there on the left side under the then category. And then our current understanding now, today, what we know is on the right-hand side. So first and foremost, we know that science has evolved from an idea of the fact that older adults are seen as senile. That's how we used to see it. Now we have more of an understanding of the pathology in the brain, that leads to aging brain diseases like Alzheimer's disease. That's what AD stands for there on your slide, Alzheimer's disease. But we know that Alzheimer's disease is not inevitable. So we know not all older adults will develop Alzheimer's disease or other brain aging diseases, but we do know that age is a significant risk factor. So as you grow older, your risk might increase, but you don't necessarily, or you're not necessarily guaranteed to become impacted by an aging brain disease. So again, we used to think that, most people as they got older, they got quote unquote senile, but now we know that's simply not the case. That pathology in the brain impacts some, but not all older adults. Our next shift in thinking involves cell loss. So back 50 plus years ago, it was thought that with aging comes extensive cell loss in the brain. But now we know that it's not necessarily extensive cell loss that occurs in normal aging, but there is significant cell loss in abnormal brain aging. So it really depends on how the pathology of the brain, or how the pathology is impacting the brain. Third on the lists here, we also had a perception about 50 years ago that the brain really just sits back and deteriorates as we age. But now research is discovering that changes are occurring in the brain even through our older years, and the brain is able to adapt and compensate. They still have the ability to learn new things and compensate for parts of the brain that might have deficiencies. So the brain involves a lot of plasticity. It can, again, learn and adapt even into older ages. Fourth on the list, about 50 years ago, there was really no known genetic risk factors for cognitive aging, and now researchers have discovered that really there are many complex and interacting factors that impact our longevity and our cognition, and I'll talk more about that later. And there was once, and our final comparison of then versus now, number 5, is that there was once few known lifestyle risk factors for cognitive aging, but now research has discovered that many lifestyle factors can contribute to how we age and can impact our cognitive aging. There has been many studies recently that have been focusing on lifestyle interventions. A really interesting study that I've been following is called the Pointer Study. It's a very long acronym, but this is a study that's really being done across the globe. It's being done in multiple countries, and it really is looking specifically at lifestyle interventions, diet, exercise, socialization, and how it impacts Alzheimer's disease specifically, so how it impacts our brain aging. And here in the United States, the Alzheimer's Association is heading up the U.S. Pointer study. So here in the U.S., we're also studying it. So the results are still kind of trickling in. I'm headed to the Alzheimer's Association's International Conference next week, so I'm hoping that they will give an update on this study. And if you're interested, I'd encourage you to follow the Pointer study because it is some exciting research. And if we can understand the things we can do in the years leading up to our retirement years and so forth, if we can introduce those lifestyles, those risk-reducing factors at a younger age, just think at how much that could impact our cognition in our older years. So again, that U.S. Pointer study will be really interesting to follow. So this just gives you a snapshot on how much progress has been made in aging brain research over the years. We're really learning a lot. There's so much research out there that's being done. So let's take a look at the brain and just kind of get a refresher on the anatomy of the brain. And since we'll be talking about the brain throughout the rest of the presentation, I thought it'd be good to kind of break it down into the various regions and show how these regions direct our thinking and our behavior and so forth. So if we look at the frontal lobe, which is the red portion of the brain that's depicted here on the slide, it's responsible for initiating and coordinating our motor movements. It's also responsible for our higher cognitive skills such as problem solving, decision making, critical thinking, planning, organizing, and also certain aspects of memory, specifically our working memory. It can help us keep information for a short period of time and then move it to our long-term memory. And it's also uh, involved with many aspects of our personality and emotional makeup, such as our empathy, emotion regulation, and it also impacts our ability to move about, impacts our movement. If we look at the parietal lobe, which is depicted on the screen in blue, this is important for our higher order functioning as well as our sensory processes. So that's touch, our sensation, our pain receptors. It also impacts or is responsible for aspects of our language and movement of our body through space. So any damage to this part of the brain, depending on the side that is impacted, can result in difficulty navigating spaces, even familiar spaces, and it can also impact our ability to understand the spoken or written language. Our occipital lobe in green on our screen here, it really helps with our processing of visual information, including the recognition of shapes and colors, so really connected to our eyesight. Our temporal lobe is displayed here in yellow, and this is important also for memory, especially long-term memory. Helps us reflect on past experiences and learn new information. It's important for our experience of emotion, emotion processing, especially fear. And this is where the amygdala, it connects with the amygdala and again processes those emotions, especially our kind of fight or flight emotions, fear, that sort of thing. It is also important for our sense of hearing. And the hippocampus is also located in the medial temporal lobe, which is often studied in relation to memory. So if you're reading a study that relates to Alzheimer's disease or cognitive impairment, oftentimes the study will refer to the volume of the hippocampus because we know that when cognition is deteriorating or parts of the brain are deteriorating that impacts cognition, oftentimes it causes shrinkage of parts of the brain. So the volume of the hippocampus is important to study in relation to Alzheimer's disease because it can help us better understand the extent of the damage that's been done to that area. And then in orange, we have the cerebellum. And this is not necessarily a lobe, but it really is important for our balance and coordination. And then in purple, we have the brain stem, which allows the brain to connect to our spinal cord, which is important for breathing, heart rate, controlling our body's temperature. So the brain, I could dive in deeper on each of the various regions, but that's just kind of a high-level overview. And as we age, changes, again, are occurring in all parts of our body, including the brain. I mentioned that certain regions will experience shrinking, especially those that are important to learning and other complex mental activities. And with age, neurons in certain brain regions may be reduced, causing communication issues between the neurons or the nerve cells. The blood flow in our brain may also decrease, and older adults may experience more inflammation, which occurs when the body responds to an injury or disease. These changes in the brain can, again, affect cognition, even in healthier older people. So, for example, some older adults find that they don't do as well as younger people on complex memory or learning tests. However, we have found through research that they can do as well, but it might just take a little extra practice, a little extra effort. We do know that the brain maintains that plasticity or ability to adapt, learn new things, but again, it might just take a little longer to get there than in the younger years. Research has also found that the brain has what's called a cognitive reserve, which is the brain's ability to work well even when some parts are deteriorating or disrupted. And research has also found that people with a higher cognitive reserve with more education seem to have people with more education, people that seek higher degrees and so forth, they seem to have a higher cognitive reserve, which could be a protective factor against aging brain diseases. So we've talked about the various areas of the brain. So let's talk about different age-related changes that an older adult might experience. So when we look at age-related changes that are found in the brain, we can break them down into kind of two categories. So we have cognition, which I'll go over on this slide, and then we also have changes in our emotion and social behavior, which I will go through on the next slide. So first we're looking here at cognition. So as we age, we might see age-related changes that are specific to memory, our short-term memory and our long-term memory. So, of course, aging brain diseases will impact our ability to recall short and long-term memories. When we look at attention, this involves our ability to focus on one task or activity. And as we age, it might be normal to experience a decrease in our attention. And for those that have aging brain diseases, it's likely to be even more significant over time. The executive function, this involves our ability to make decisions and to plan. And so if an aging brain disease is occurring in an individual, if this area of the brain is impacted, they're likely to experience difficulties in these areas. And then the processing speed. This involves how quickly we can take in information, understand it, or process the information. And that can also be impacted as the brain ages, especially with aging brain diseases. So I mentioned the other category is the emotional and social behavior that can be impacted as we age, and that includes a variety of the things you see listed here on the screen. But when we think about our emotion and social behavior, and we think about that in terms of the aging population, oftentimes they're experiencing not only physical changes such as health changes, their bodily organs and processes are aging, but also they're experiencing the emotional perhaps stress and strain of loss. Maybe it's a loss of their own independence, loss of a spouse, family member, a friend. These can really impact their emotions. And so when we think about the aging brain diseases and how they relate to emotion and how a brain ages, it's important to consider the impact that this will have. So we do know that negative emotions do decline with age, and that positive emotions generally increase in frequency. We also know that with age comes greater emotional well-being and emotional regulation. We also found research has also found that older people report experiencing greater emotional well-being than younger adults. We find that with age, again, the ability to regulate our emotions is stronger in a lot of cases than younger populations. But when we take into account aging brain diseases, it might impact things like our ability to empathize. It might cause more emotions that are a result of symptoms of the disease, such as aggression. But for the most part, individuals with aging brain diseases are still able to maintain the ability to express basic emotions, at least through the majority of the aging brain disease. So things like happiness, fear, sadness. I mentioned that emotional regulation increases with age, but for somebody who has an aging brain disease, they might not be able to regulate those emotions quite as well as other older adults that are not experiencing brain aging. But we do know that socialization and interacting with others is very important as we age. Isolation and loneliness is a very hot topic right now. We know that if individuals are isolated and lonely, it can increase the likelihood of dementia or aging brain diseases. So it's really important to try to prevent things like social isolation. But we do know that aging brain diseases can impact our social emotions and impact our personality traits. Of course, also our relationships change as we age, and the emotions that come along with that can also be impacted. So I want to now talk about normal versus abnormal brain aging. So I've talked about it a little bit already, but normal aging is associated with some cognitive decline, and it's generally subtle, subtle and impacts the person in subtle ways. So older adults might experience a slight decline in their speed of thinking, their attention control. Multitasking might become a little more difficult. So, you know, we all probably have gotten up off the couch and walked into the other room to find ourselves thinking, what did I come in here for? Or you get out to the parking lot and you temporarily forgot where you placed your car. We all kind of experience these small instances of forgetfulness from time to time. And for older adults, this might occur a little more frequently. But usually, if we sit back down on the couch, all of a sudden we'll remember what we were looking for, or as we're out in the parking lot, we'll kind of go back through our memory of when we got to the destination. Remember, we parked next to that little red sports car, and that can help us, get back to the car. So as we age, it might take a little longer for us to trace back through those memories to recall what we were getting up to get or where we parked the car. But it's for those individuals who may not be able to remember at all, that is when there is cause for concern, because likely there is some abnormal brain aging. So we know that abnormal brain aging is really pathological. So it is a disease that is impacting the brain. And again, this pathology is not a part of normal aging, nor is it going to impact every older adult. So when abnormal brain aging occurs, as you can see on the slide here on this picture, on the left side it shows a healthy brain. So it looks, the tissue looks healthy. The pink tissue is shown there. The crevices are looking kind of normal. The ventricles are of normal size. But in aging brain diseases, again, I mentioned earlier, there is often a shrinking of the brain, especially in Alzheimer's disease. And so on the right side of the screen, you can see just how the pathology, the disease in the brain, has caused it to shrink in size. Also, the ventricles, kind of the holes that look it looks like holes in the middle of the brain. Those have increased in size. Those folds have become more pronounced. That is what is occurring. Really, in aging brain diseases, specifically Alzheimer's disease, there's a thinning of the white matter, a thinning of the cerebral cortex. Again, I mentioned earlier the shrinking of the hippocampus, and an enlarged ventricle. So if you were at autopsy to open up the brain, this is what it would look like, a healthy brain versus unhealthy brain. And it used to be that was the only way to really tell if somebody truly had Alzheimer's disease or had other aging brain diseases. But fortunately, technology has come a long way, and there are some ways that we can better diagnose Alzheimer's disease in somebody that is living. And so we'll talk a little bit more about that. But just a few more points on abnormal brain aging. So abnormal brain aging involves the decline in cognition that's more severe, and it impacts our thinking abilities, such as rapid forgetfulness or difficulties navigating, especially solving common problems, expressing ourselves in conversation, or behaving outside of social rules or social norms. Abnormal brain aging can also include impacts to the motor system that might result in excessive trips, falls, or tremors. And when these types of abnormal changes start to occur, it is very important that an individual gets medical attention for further evaluation. The excessive trips, falls, or tremors, that could point to an aging brain disease such as the Lewy body dementia or Parkinson's disease. And, some of the problem solving, poor judgment, those types of signs could point to an aging brain disease like a frontal temporal dementia, because that's the area of the brain that's likely to be impacted first in that type of dementia. So when I talk about abnormal brain aging, people often ask me about the influences or the factors that put somebody at higher risk possibly than others. So we've talked about how again, aging brain diseases are not a normal part of aging, but there are some factors of influence that researchers have discovered. And the first is genetics. There are certain genetics that put you at a higher risk for some aging brain diseases, but again, it does not guarantee that you will develop the disease. So just like age is the most common risk factor for aging brain diseases, it still does not mean that an individual will develop an aging brain disease. So in terms of genetics, if an individual has a specific gene that could put them at a higher risk of something like Alzheimer's disease, it still might mean that the individual will not get Alzheimer's disease. And I know that the genetic testing kits like the 23andMe, they're becoming very popular, and they can test for these types of genes, such as the ApoE genes, that can increase someone's risk of Alzheimer's disease. So more and more people are discovering whether or not they have this gene, but it's really important to understand that even if you have the gene, it does not guarantee the person will get the disease. There are some other genes that might increase the risk at an even higher rate, but it's a very, very small percentage that the person might develop the aging brain disease. And there are some familial genetics. If you have a loved one who had the disease, you're at a higher risk of having the gene, but again, usually does not guarantee that the individual will develop the disease. So we don't want to scare people by letting them think that we all have the gene and that we're all going to get the disease. We need to communicate that it is a risk factor, but does not necessarily guarantee that the individual will get the aging brain disease. There's also things in our environment that could influence these aging brain diseases. In some parts of the country, for example, there are higher levels of Parkinson's disease, and they do think that there might be a link to certain, pesticides or chemicals that have been used in certain farming communities and that sort of thing. Our education level, the socioeconomic status of an individual, someone's occupational complexity and their lung function, maybe due to smoking, exercise, environmental exposures, those types of things. Those can all be environmental factors that could possibly increase or decrease the risk of an aging brain disease. And also the socialization that we engage in is also an important environmental factor of influence. And I've talked a little bit about this already, and we'll go into more detail in the later part of this presentation about our health and lifestyle. Maintaining your health, maintaining chronic conditions can also be a factor of influence, especially chronic conditions that affect your heart and affect insulin levels. They're finding those types of chronic conditions, if poorly managed, could increase the risk of cognitive impairment and aging brain diseases. And so we'll be talking more about, lifestyle factors towards the end of the presentation. But I've mentioned Alzheimer's disease quite a bit because it is a common aging brain disease that we're hearing more and more about when it comes to the aging population. But there are other aging brain diseases. And as I mentioned at the start of today's presentation, this is a two-part series. So I'm going to dive deeper into each of these aging brain aging diseases in next month's webinar, but I did just want to touch on them so that you knew that there were other aging brain diseases besides Alzheimer's. I know, again, I keep using that as an example, but when we talk about brain aging diseases, a lot of times the acronym MCI comes up. This stands for mild cognitive impairment, and this affects memory to the point of being noticeable to others but does not interfere with daily functioning. And people with mild cognitive impairment may exhibit some forgetfulness of recent events, but again, their forgetfulness, their cognitive impairment is just as it says, pretty mild, and they can still perform their activities of daily living. You might find that they're needing to write themselves a few more reminder notes so that they will not forget, but they can still generally do things like pay their own bills, remember to take medications, maybe with reminders, those types of things. But it's important that when those things start to occur, that they are still going in for medical evaluation, because we do know that about half of individuals that are diagnosed with MCI, mild cognitive impairment, go on to develop Alzheimer's disease, and usually it's within 5 years or so. So even if there is a diagnosis of MCI, again, it's important to keep up on those medical appointments to track any further progression of the disease. Then there's the dementia category of aging brain diseases. And dementia is an umbrella term that refers to the decline in mental ability that's severe enough to interfere with our daily lives. And there are various types of dementia that fall within the umbrella. The most common is Alzheimer's disease. And so Alzheimer's disease is something I've been mentioning quite frequently. It's these plaques and tangles in the brain that interfere with the nerve connections, the ability for nerves and nerve cells to communicate. And so when they're not being communicated, oftentimes there is cell death and cell loss, which leads to that shrinking of the brain. There's also frontal temporal dementia that involves damage to that frontal temporal lobe of the brain. And as I mentioned earlier, that's really important for judgment, language, those types of things. And then there's vascular dementia that is caused by inadequate blood flow to the brain. So you often see that maybe in conjunction with individuals who have had a stroke or mini strokes. There's often a correlation between vascular dementia and some sort of stroke. There's also Lewy body dementia, which is commonly diagnosed with Parkinson's disease. So you might see those two diagnosed together. And of course, Parkinson's disease impacts an individual's motor and movement. So again, next month, I'm going to dive deeper into these aging brain diseases. I'm actually going to spend pretty minimal time on Alzheimer's disease, because in September, I'm doing a deep dive into Alzheimer's. So I'm really going to zoom in on those other types of dementia and Parkinson's disease. So I hope that you will join me for that and to learn more about these aging brain diseases. But they really do impact a person's daily life. So with these aging brain diseases, there is general decline. It's unfortunate that there is not a cure for any of these aging brain diseases, and it is progressive in nature, which means it will worsen over time. So some may progress pretty quickly through the disease, while some may progress slowly and may live with the disease for years and even decades. And with the decline, there is usually a loss of independence, which can be a challenge to accept, and eventually there will be a need for assistance with things like activities of daily living and instrumental activities of daily living, so those ADLs and IADLs. And when we think about it, the older adults that we serve, once the abnormal brain aging starts to impact daily life, these family caregivers are often the first to step up and help with these activities of daily living. And there's also usually a need for increased medical care. So family caregivers are often having to accompany their loved one to medical appointments, help to keep on top of the medical needs of the individual. And in the care of those living with aging brain diseases, it's really important to take a personalized or person-centered care approach because the symptoms vary by disease and often vary from person to person. So when we look at, Parkinson's disease, for example, their motor skills are impacted. Oftentimes there are tremors that make it challenging to grip items and that so forth. They often have challenges in their gait or their ability to walk, which is very different from an individual with Alzheimer's disease who might be impacted more so by memory loss or frequent agitation, and so forth. So while the various aging brain diseases have differing symptoms, and they do vary, there are some common signs of abnormal brain aging that we can share with the families that we work with, the older adults that we work with, that can point to the need for a medical visit. So I really do like this graphic. It's from the National Institute on Aging. Again, this is specific to Alzheimer's disease. I'm going to offer up some additional symptoms on the following slides, but I do like this graphic because it's easy to understand. It communicates normal versus abnormal brain aging in a pretty clear manner. So, on the left we have normal aging, on the right we have signs of Alzheimer's disease. So, in normal aging we might make a bad decision every once in a while, but a sign of Alzheimer's or another form of dementia might be poor judgment and poor decision making more frequently. Missing a monthly payment here and there might not be that big of a deal. It might be part of normal aging, but when problems taking care of monthly bills becomes a reoccurring issue, that might be a sign that something's going wrong. And actually, financial management can sometimes be is commonly a first indicator that there's something that is not right in terms of cognition. There might be a sign or symptom. If the individual is not making payments that they once were making on time every single month, or perhaps they are spending money in a way that they have never spent before. They're making poor judgment in investments or something of that nature. That can be a sign that there's something going on in terms of cognitive changes. Forgetting which day it is and then remembering it later might be normal, but really losing track of the date or time of year is a sign that maybe some more evaluation is needed. Sometimes forgetting which word to use is a normal part of aging, but having trouble with conversation is another sign. Losing things from time to time, not that big of a deal, part of normal aging, but misplacing things often and being unable to trace your steps to find them, when that starts to occur over and over, that might be a sign. So I have some additional symptoms to watch for that kind of point to more general abnormal brain aging. So we can pass these symptoms and signs along to those family caregivers that we work with in our professional lives. So getting lost in familiar places, that can be an indicator that something is changing in the brain. If any of you have seen the Still Alice movie, there's a very vivid moment that sticks out so prominently in my mind. It's the scene where she's going for a run and she's going on the same route she's taken for years and years, and all of a sudden she gets lost and doesn't know how to make her way back home. That's definitely not a part of normal aging. So if your loved one, always drives to the same grocery store the same way and all of a sudden can't find their way home, that might be an indication that further evaluation is needed. Repeating questions, asking the same thing over and over, odd or inappropriate behaviors that are outside of the norm. I want to make an emphasis on that. Some people just tend to have odd behaviors, but when they are outside of the norm, that's when there might be cause for concern. And before I go any further, I will say, if these things happen from time to time, again, might not be cause for that much concern, but it's when these things are happening over and over, or you're seeing multiple symptoms or signs, that's when there's cause for concern. So it might be helpful to suggest to caregivers, keeping a little journal to track when these symptoms are happening to see if there are any patterns. Can be especially helpful when pursuing medical evaluation for any sort of cognitive impairment. And then forgetfulness of recent events, that short-term memory loss, repeated falls or loss of balance. I mentioned earlier, these types of signs or symptoms might be key to look out for, specifically in relation to Parkinson's or Lewy body dementia, as those impact our movement and motor skills. And there's a few more symptoms here on this slide. Changes in personality or mood, an individual who was always maybe mild-mannered but now is getting more aggressive or is extremely irritable, that might be a sign that there's abnormal brain aging. Also, a decline in ability to plan and organize. I had an individual I worked with. She was an amazing baker and had all of these recipes memorized and could really whip up anything from scratch at any time. But her family started to notice that the recipes were tasting a little off, and then she really kind of stopped baking. And that was kind of a sign to them that, okay, something's not right here with our loved one. We need to get her in for a cognitive evaluation, because they were realizing she was forgetting those recipes, and therefore she just kind of stopped baking and was too nervous to tell anyone that she was experiencing cognitive changes. You might also start to recognize changes in their diet and eating habits. Maybe they're forgetting to eat or forgot they've already eaten. Changes in hygiene. If their appearance is changed, maybe they're less put together. Perhaps they are forgetting to bathe regularly. You might notice changes in that hygiene routine that could be a sign that there's something else going on there. An increase in apathy, and then changes in language abilities, including an individual's ability to comprehend. Again, maybe they can't come up with the word or follow a conversation or follow a storyline. Again, those are all symptoms or signs to watch out for. So if these are noticed, it's really important to schedule a visit to a healthcare provider. Early detection and diagnosis is extremely important. I hear people say from time to time, why would I get a diagnosis if there's no cure? I mean, that's kind of a valid question, but what we want to communicate is that it still is important, because there are benefits to having a diagnosis. It in many cases can open up doors for resources and support that they may not otherwise be informed of. Another thing I hear from time to time is that providers do not want to diagnose because they feel like they don't have any resources to provide the patient. They don't have, the hope of the magic pill that will fix it, or that sort of a thing. But again, it's still so important to diagnose, because there can be medical benefits. Regular medical appointments to help with symptom management, keep track of the disease progression. There are some medications out there that can help with the symptoms, the symptom management for many of these diseases. And so if a medical diagnosis or medical attention is not sought, the individual might not otherwise have access to those medications and those therapies and alternate behavioral interventions, those types of things. There's also emotional and social benefits to having a diagnosis, getting detected early on. There's a couple who does a lot of advocacy work in the Alzheimer's space, and I was talking with them, and they shared with me that a diagnosis really saved their marriage. They were about to get divorced. They were kind of at their wits' end with one another, because the husband was realizing there was a lot of personality mood changes in his wife, and thought she might be doing it out of spite or to irritate him. But really, there was underlying factor Alzheimer's disease, and having that diagnosis helps them, process the diagnosis together as a couple, find resources, support, that sort of thing. I know that's not the case in every situation, but there are, emotional and social benefits to having that diagnosis. It also can allow for legal, financial, and care planning. When these things are done early, it can ensure that the voice of the individual living with the disease is heard, and it's also able to make sure that the wishes of the individual are known. This can also help reduce feelings of guilt, ambiguity, sadness for all parties involved, the family, caregivers, the individual living with the disease. And it can also allow for the individual to seek out a specialist, a neurologist, can also help possibly even get them connected to clinical trial participation, which is something that's really important. Clinical trial participation needs individuals living with the disease to engage in medication and treatment options, brain scans, that sort of thing, so that we can hopefully one day get to a cure. And then there's also research that shows an early diagnosis can provide a cost savings. This is due to things like proper planning, involving resources to help keep the individual at home longer, which could delay a move to a facility, memory care, assisted living, nursing home, and so forth. So there are some benefits to getting a diagnosis. And sometimes families are hesitant. They don't know what to expect when they see their healthcare providers. So as professionals, we can share with them the various things that might occur when they go in for an evaluation. Of course, you're going to start out with the full medical history. Likely, if they're going to kind of their general practitioner, an internal medicine doctor, they might issue a mental status exam, which then might be a reason to refer them on to a specialist if the individual scores at a certain range of the mental exam. And so that might be a next step, is to see a specialist such as a neurologist. There's also likely to be a physical exam, diagnostic testing. This is important because these signs and symptoms could be due to another underlying issue. For example, urinary tract infections, UTIs, can provide a certain or a sudden onset of some of the same symptoms as cognitive impairment. Same with some vitamin deficiencies. So they want to rule out all other causes before a firm diagnosis of an aging brain disease. There's also newer technologies that allow for brain imaging to be used in certain situations. PET scans are one of those ways, and often a neurological exam and a more extensive workup will be done, especially if a specialist is seen or if they visit a specialized geriatric clinic. So diagnosis and detection, fortunately, has come a ways in the last 10, 15 years. And these, real quickly, are the National Institute on Aging's strategic directions for research on aging. I just wanted to share those to let you know that there is a lot of research being done. So I feel like, I apologize, this presentation might be a little kind of down in the dumps, doom and gloom, but there is hope because there is a lot of research being done in the field. So the NIA is working to understand the aging brain, Alzheimer's disease and other dementias, other neurodegenerative diseases. They're working to develop interventions for Alzheimer's and other neurological conditions, and also develop interventions to help maintain health and well-being, our function, and also prevent or reduce the burden of these age-related diseases, disorders, and disabilities. So that last bullet is really what we're going to be talking about from here on out. How can we reduce the risk of these aging brain diseases, and hopefully we can start as early as our 30s, 40s, and 50s, because what we do in those earlier years can impact our brain health down the road. So when we talk about risk reduction, this is also really important for family caregivers. They often put their own needs on the back burner, which can result in new chronic conditions, untreated mental health issues, and in extreme cases, the caregiver might even pass away before the individual that they're caring for because they put their own needs on the back burner. So it's really important for people of all ages to be engaging in these risk reduction behaviors. And research, again, is revealing that some of these aging brain diseases, like Alzheimer's disease, can start to develop as far out as 20 years before the first symptom presents itself. So the more we can do to reduce the risk, the better. So it's important to maintain those regular doctor's visits, keep up on those health issues that arise over time. And for individuals that are Medicare eligible, at the annual wellness visit, a cognitive screening is now covered. So it is good to have that cognitive screening done as early as your first Medicare wellness exam, just so that you have a baseline of your cognition and can track changes over time. And then also the managing of chronic conditions I mentioned earlier, especially diabetes, hypertension, CHF, those types of things. And I mentioned diet and exercise are important for reducing your risk. So regular exercise, of course, consulting a physician before engaging in exercise can be a great way to reduce risk. Cardio, yoga, meditation, those types of things are great, as well as strength training. Whatever exercise you enjoy, pick one and do it regularly, and hopefully will help reduce risk. Also, engaging in healthy sleep hygiene. Research is showing that sleep is so important in reducing our risk of aging brain diseases over time. And then eating a balanced diet. There's a lot of research around the MIND diet or the Mediterranean diet. As you can see on the screen, the pyramid there, I like this graphic because it shows, not only is the social engagement important, movement, but also eating lots of fruits and vegetables, lean meats, and good healthy fats like olive oil are important to reducing risk. Also, maintaining your cognition involves engaging your brain, whether it's through cognitive exercises, learning something new, getting creative. Maybe it's learning a new hobby. Maybe it's getting into the arts, socializing, joining a book club, or engaging in a regular men's group, something that gets you socializing on a regular basis. Socialization is so important in preventing that social isolation, which again can impact your cognition and brain health. And then finally, some additional tips on reducing risk. Protecting your head. We're learning that brain injury, even in our younger years, can impact our brain health in later life. Concussions, those sorts of things, if those can be prevented, then again, it can help reduce the risk. If inflammation can be prevented throughout the body, that can also help with risk reduction. And then keeping stress levels low. And this can be easier said than done, especially for the caregiving population. But we know that high levels of stress releases cortisol in the brain and various things that can impact our cognition over time. So practicing mindfulness, meditation, seeking treatment for things like depression, other mood or mental health issues, again, can be important in maintaining good cognitive health well into older years. And then smoking and alcohol. If the individual is able to quit smoking or avoid starting to smoke, and then also limiting alcohol intake, again, can go a long way in good cognitive health well into our older years. So those are some tips on how people of all ages can reduce their risk of aging brain diseases. Unfortunately, we don't know of anything that can 100% prevent aging brain diseases, but again, these types of things can help reduce the risk. And that's why that pointer study is so important, I think, in determining which lifestyle factors can impact our abnormal brain aging versus healthy brain aging. So very interested to see the results of that. And if I hear of anything, I'll be sure to share it on my next webinar. So with that, I'm going to show you just a couple resources. I usually have a long list of resources, but this month it's somewhat short. But brainhealth.gov is a great site if you want to get more information. The Memory and Aging Center at UCSF has some great information. Along with Cleveland Clinic, they have healthybrains.org. There's also a few women's groups that have really kind of taken on brain health as a cause, one of which is the Women's Brain Health Initiative. They have great articles. They take the science of brain health and package it in a way that's really easy to understand. They have a great magazine, so you can check them out at womensbrainhealth.org. There's also Women Against Alzheimer's. They have a 30-day brain health challenge. And you can find that at bebrainpowerful.org. It's a little something that you can do each and every day to maintain your brain health. And of course, the Alzheimer's Association has great information as well. So with that, I'm going to turn it back for questions. I apologize, there's not much time left for questions, but again, I hope you'll join me next month as I dive deeper into those aging brain diseases. But with that, I will turn it back over for a few questions.
All right, excellent. We do actually have several questions coming in and a few minutes to get them answered. So the first question actually is important in that, how do you spell pointer? People are looking to follow up on that, and they want to make sure they have the spelling correct.
That is a great question. I'm just going to Google it right now just so I don't get it wrong, but it is Pointer, so just like you would think. And actually, if you want to learn about the U.S. pointer study, the website is alz.org/US-pointer. And if you just Google it, pointer study, you'll get lots of hits on Google or Bing or whatever. So yeah, it's just pointer study. That's a great question.
Excellent. So another question, if the caregiver is noticing that the senior is isolated and doesn't want to socialize with others, what should the caregiver do? What if the senior is preferring isolation?
You know, that's a great question. And, you know, when I see cases where the older adult isn't wanting to engage in socialization, it makes me wonder, you know, why. So if it's possible to further explore the reasons behind the socialization, maybe it's because they prefer to stay within kind of the four walls of their living environment. Perhaps there's ways that they can socialize maybe over the telephone, or perhaps technology could be introduced into the situation so that there's at least some communication. But if you can find some point of interest that kind of the older adult maybe used to love. So perhaps they were in the military, or perhaps they were an avid golfer or really enjoy birds or something of that nature. Trying to get them connected socially in a group or with those individuals who also like that activity can be a good way to engage, but it really is situational. So if you can get to kind of the root of why they're choosing not to engage socially, hopefully you can help find a manageable way that they can engage. And maybe it is starting out small, maybe just once a month or once a week, but it can be so important. So that's a great question.
All right, and then the final question that we will be able to have time for is, how do we speak to somebody about going and getting checked out by their PCP if they're starting to exhibit these changes but are reluctant to do so? They seem offended when the suggestion is broached.
Yeah, that is a great question, and it can be challenging to get the individual to go in for some sort of cognitive assessment or screening. So, I mean, there's various approaches you can take, and again, it's very situational. So, if the family caregiver or person that's suggesting this can share a story of a friend or relative who has gone through the scenario and has had a positive experience, sharing that, or saying, at my next checkup, I'm planning to get a cognitive screening. Have you thought about getting one? That could be a way to approach it. The Alzheimer's Association also has some great resources on early detection and diagnosis. If you go to the alz.org website, there is a section on there. If you just kind of search in their little search bar about early detection and diagnosis, they have some great tips. So, sometimes it can also be helpful for the caregiver to, if the individual is absolutely not going to go in, before their next kind of annual wellness visit, you could make a call to their healthcare provider and just say, hey, I've noticed some changes. If you could consider bringing up cognition to see if my loved one will engage in the conversation, that might be kind of a way that you can go about it where it doesn't seem like it's coming from you as the family member, but more so coming from the healthcare provider. So that's a really great question. But again, I would go to the Alzheimer's Association's website. They have some more tips that hopefully are helpful. But thanks for that question.
All right. Well, unfortunately, we have, in fact, reached the end of our hour, and it is time for us to wrap up. I'd like to thank Lakeland Hogan so much for being with us here today. Thank you very much.